Hello, good afternoon. Today I'm going to show you how to do the HIV testing on Kenya EMR. So let us continue with our client who we had registered. So you go to home, then you come and registration, then we want to find our client. Let us use the ID number. The ID number is there. Let us check out and see. Only checking client. There we have a client here. So we want to check in our client today. So we want to offer HTS services. So we check in the client today. As you can see, we have triage, so we go straight away to the triage. So maybe our client one, let's say HTS services. Next temperature, let's say 35.4. Then you can put 72 out of 130. Okay, weight, let's give that person 72. Then the height, we give that person 171. Okay, so next, have you abstained from food? Let's say no. Last menu, yes. FP, are you on FP method? Yes. Then have you had a MS card in the last 7 days? No. Okay. Did you refer the client for pregnancy test? No. Then we enter the form. Next, what we are going to offer, we should screen for PHQ9 if the client has not been screened, but for now we want to go for HTS eligibility. So we go for HTS eligibility. So this is a GP. Any disability? No. Department, let us put VCT. Patient, it depends where the setting of your hospital. You can put community outreach if it is an outreach. Then for maternal, we have PMTCT. Then we have maybe for emergency or OPD, depending. But for now, let us use VCT. Then we use the non-patient. Client, a health worker? No. Then sexual contact? No. Social contact? No. Needle sharing? No. Then we put none. Okay, strategy used, we will use the VI, integrated VCT center. Okay, tested before, that details client will provide whether whether the client has been tested or ever tested or not. So for now, let us say no. Now we want to assess the client's sexual behavior. Has client ever had sex? Yes. Client sexual active? Yes. Has the client had a new sexual partner in 3 months? Depending on the client feedback. But for now, let us assume she has had partner. Maybe he doesn't know the partner's status. Discordant couple? No. Engage in unprotected sex? Yes. So what I'm trying to do, I want this client to be eligible so that we see how we do the HTS testing. So does the client engage in sex under influence of alcohol? Let's put it sometime. Have you ever had unprotected sex in exchange of money? Let us put yes. Maybe you can find that person is a FSW, female sex worker. So let's say no. Then this one is for GPV. Then say no. PrEP. If our client has never used this one, you don't tick. But let us see. Has client been screened for TB? If you have screened for TB or you want to screen, you will say yes. Then you say coughing? No. Fever? No. Noticeable weight loss? No. Then night sweat? No. Now we come for traditional? No. Then is client currently pregnant? Maybe. No. Breastfeeding mother? That will depend on the client. For now, no. Now you see, eligibility for client, the client is eligible for testing. It has already indicated that the client is eligible for testing. So let us get the category. Medium for what we have said. If you come here, you will see under exchange for money, then use unprotected sex for the last 12 months. Okay, so what we do, we recommend. Do you recommend for HIV testing? Yes. Why do you recommend for testing? We can base here category, or we can base for both. Refer client for testing, then we say yes, then we enter the form. Now that is the part for screening. Now we want to go for, after that we go for HTS initial form. It is here. So let us see what it has in store for us. Okay, in this form you will enter the date for today. Then, does the client have any disability? You'll assess the client. For now, my client doesn't have any disability. Now, HIV test history. Has the client ever been tested by an HTS provider? No. Has the client done HIV self? No. So HTS settings, let's say it is facility. That is why we choose from the screening we had earlier. HTS approach. This one will be client CICT. Indicate used, we will use integrated VCT center VI. Now TB screening, no TB. You remember we did TB screening. Has the client given consent? Yes. When you say no, everything closes because the client must give the consent. Now let us, now client tested us individual. For me, I'm doing client as individual. Okay, so as we move on, we shall see the different scenario of testing, whether the client react, whether the client is negative, client testing for PrEP, PEP and all that. But for now, let us test our client and give that result as negative. So let us start. The kit name, we start by determine the lot number. So let us see. Okay, let us try to use the last expiry date. Let me give it December 31st. HIV result, let me give her negative, then you must clear here. Client result given to client, yes. So now couple is discordant, not applicable. Client referred for other services, maybe it will depend. For now, let me now refer that client for PrEP, maybe. Yeah, let me refer that client for PrEP, maybe, and also risk reduction. Now what I'll do here, put remarks here. You see, this remarks is very helpful. Let me show you. You will say client, you will say client referred for PrEP. Okay, so you'll find that this remarks is the one that appears in 362, MOH 362. This feedback will be shown at that end. So for now, let us close. We have now tested our client. We have given that client the result. Okay, now we submit the form. Thank you for watching the video. You will see here is what we have. This is the HTS we have done, that is initial form, and we have given our client negative result, and we are also going to give that client PrEP in our next video. Thank you for watching, and when we come back, we will see how to fill in PrEP and give the client PrEP. Thank you for watching.